Hi, thank you so much for joining in.
Yeah,
Great, great.
thanks for having me.
Yeah, this is fun. Um, so if anyone's watching today live, please say hi and where you're from. If you're watching this at a later time, please type in hashtag replay so this can stay up on top of our feed. And I will also be posting this to our other channels, including YouTube. Um, so anyway, so let's get started. Today, I'm Dr. Prabakar, the Fibroid Doc, and I have Dr. Justin Thompson with me. Really excited for this topic, and he's a pioneer in concierge obstetric care here in the Bay Area. So before we get into it further, Justin, I'll just have you introduce yourself a little bit more, kind of a little bit more about your education and also where you are right now.
Yeah, thanks so much, Cheruba. And I would say that you are the pioneer of gynecologic concierge care, and so we actually are just each other's counterparts or partners, if you will. And for your followers who are familiar with the great care that you're providing, my passion and vision is just very similar, but on the obstetric side. And so if you think of OBGYN as really kind of two different fields, all part of women's health, one being obstetrics or pregnancy care, is what I'm very passionate about, and the kind of perfect other half of what you do, which is the gynecology side of things, or non-pregnancy women's related care.
Yes, absolutely. So that's right. So I actually don't do much OB in my office. And for those who are listening, some people are confused about what those terms even mean. OB/GYN, right? OB is the obstetrics part. As you said, it's the babies and delivering babies and the pregnancy part. And then the gynecology is sort of everything else, breast disease and bleeding and fibroids and ovarian cysts. There are some doctors that do both, and I think we are all trained in both, but most people tend to gravitate towards one or the other. And so tell us a little bit about kind of where you went to school and what drew you to this field of OBGYN, and then particularly OB
Yeah,
after that.
yeah. So I went to medical school at Drexel University in Philadelphia, and then about a little over 10 years ago, came out to California and did my OBGYN residency at Stanford Hospital. For me, I went into med school with a very open mind and a lot of curiosity. I think at one point I probably considered 10 different specialties in medical school. So orthopedic surgery, internal medicine, cardiology, and actually, OBGYN was not one of the fields I was initially considering, but I had a phenomenal rotation doing gynecologic oncology, which I know you're familiar with, Cheruba, and very amazing work caring for women diagnosed with gynecologic cancers. And I was fascinated by robotic surgery, which I know you do. And my grandmother's a uterine cancer survivor. And so I was just really blown away with the idea of being a gynecologic oncologist. And in order to do that work, you need to complete 4 years of OBGYN residency, which we both did.
Right.
So I came to Stanford with actually the goal of using OBGYN residency as a stepping stone to gynecologic oncology. And I would say within about the first 3 months, I had such an amazing time getting to know young couples, bring babies into the world. I loved the work on labor and delivery. And while gynecologic oncology is very obviously important work, I didn't really feel that same passion that I felt for obstetrics.
Yeah, that's so fascinating. I think we both are similar in that neither of us really wanted to do OBGYN. Myself as well. I was like, that is definitely not something I'm going to be doing until I did my rotation and just fell in love with it and really felt like it was a calling. And it's also cool that you said that you were thinking about many different specialties, because sometimes I feel like OBGYN, we really have to know a little bit about everything. So it's kind of cool that way.
Totally,
Right?
totally. Yeah, I agree. When you are caring for a patient, women's health is connected to almost every other, obviously, right, organ system, specialty, if you will. And as I know you do for your patients, part of being, a physician that wants to go above and beyond for your patients is often even helping them navigate how their OBGYN health is connected to all their other their health and other medical problems that they may or may not have.
Yes, yes. And especially in obstetrics, I feel like we dabble in a lot of other things like, endocrinology when we deal with
Mm-hmm.
pregnancy and thyroid, or, different rashes that appear in pregnancy, or, surgical issues. I mean, there's just a little bit of everything, which, keeps you sharp. So I like that.
Absolutely.
So one of the reasons I decided to do a little bit more of concierge gynecology is things like women were just not being able to be seen in a timely fashion, and get the access they need to help solve their problems, like bleeding, for example, and patients would have to resort to going to the ER, for example. So what are some of the reasons why you chose to deliver care the way you do? And actually, maybe even before that, tell us a little bit about, how you deliver care right now.
Yeah, I would say, if I go back to when I finished residency and was practicing OB and GYN, I was fortunate that my first job was joining a practice with a physician who, for many years, had made it his goal to deliver all of his own patients. He would see his patients for all their prenatal visits and really try to deliver the overwhelming majority of his patients. And then a dear friend and colleague of mine, Nancy Mason, who's a very well-known OBGYN in the Bay Area, was also really instrumental in shaping how I saw myself delivering care because of the phenomenal relationship she built with patients over many years. And I realized that's really how I wanted to deliver care. Being up at 3 a.m. and delivering a baby is very different when you've gotten to know a couple and seen them for, maybe 13 prenatal visits. You've been able to, over time, address all their questions, concerns, and really help them feel like they have a partner in this. And I saw a vastly different experience when I would take call for maybe another OBGYN group and just go in and, deliver a baby for a couple I had never met before. And so that was
Mhm.
kind of my vision. Now, the problem and I think just based on some of our previous conversations you've experienced as well, is that was my vision, but by working for a large healthcare system and having the constraints of the corporatization of healthcare and the insurance companies, I actually was being forced out of that. I would have monthly meetings with the higher ups, if you will, the CEOs, the chief operating officers saying, Dr. Thompson, you're only seeing 4.3 patients per hour. How can we get that number up? And I said,
Yeah.
well, quite frankly, that number is already too high. And that didn't make them happy. And so similar to the path you've taken, and I really admire you and everything you're doing. And, and congratulations on your practice's 1-year birthday party.
Thank you.
I am really passionate about delivering that same type of care and removing the constraints on physicians, so that people can, so you and I can do exactly what we want to do, which is provide the best care possible and do what's right for the patient, not what's right for the corporation or the health insurance company.
Yeah. Yeah. No, that makes a lot of sense, especially in something as intimate as women's health and
Mm-hmm.
delivering a baby. It's such a special, momentous
Yeah.
occasion in a couple's lives in their lives, and you want to have that continuity.
Yeah.
I think that's very important for many people. I know when I was in a large group practicing obstetrics, for my patients, they would always want to know if I was going to be there to, do their delivery, because
Right.
they've come to know me. And then often, as you know, that's not the case. We're in a big call pool. I mean, anybody could be there. So we're all competent physicians, but it's not the same as
Yeah.
having that one person who really knows your history. And there can also be a lot of anxiety provoking moments in pregnancy, right? Bad test results, or different complications that patients face, and it's nice to have that one person just like be your person to have
Absolutely.
explained everything
Yeah.
for you.
Yeah, I think so much of the experience for the patient and the patient having a positive experience throughout pregnancy, and minimizing, I'm really sad when I see these reports about the percentage of women that report a traumatic birth experience. And it's really sad when I see those numbers, because I think so much of pregnancy is really two things. It's not just providing good medical care. You know, when a patient goes in, we know that we have a lot of talented colleagues as part of big call groups. And I know that when a patient goes in as part of those big call groups, sure, they might get great medical care at that point in time. But pregnancy is a 9-month journey. And like you just mentioned, knowing that you can contact your doctor if you have a concerning ultrasound report or lab result really brings down the stress and anxiety level. And I think, you know, I don't like to toot my own horn. I'm not a rocket scientist. I'm really just doing, you know, my mom always tells the stories about, you know, I have 2 younger brothers, and my mom to this day remembers vividly her 3 pregnancy experiences. And she knew her doctor. She had all of her appointments with one doctor. She knew who was going to deliver her babies. And so really, I'm just trying to recreate the type of care that I think a lot of women, probably women like my mom and your mom, had access to, that unfortunately nowadays has become very rare.
Exactly. And care is so fragmented, right? I know even in pregnancy, okay, you have diabetes. Okay, now you got to go see this other type of doctor. And oh, you have high blood pressure. Okay, now you have to go see this other type of doctor. And then there's very few, the coordination of care is hard. And as a patient, it's sometimes very frustrating. And we can't really rely on patients to be the ones, you know, really keeping all this information together. So having that one doctor model really helps with that as well. So tell us a little bit about where you're located now, and how does your practice, you know, run? Say I find out I'm pregnant, you know, how does that look like, that whole journey in your office?
Yeah. So my office is in Palo Alto. I am located about 5 or 6 minutes from Stanford Children's Hospital. I have privileges at both Stanford Hospital and Stanford Children's Hospital. And so Stanford Children's Hospital is where I exclusively do all my deliveries. The nice thing about the practice I've created is it's all focused on the patient, not on rules to maximize numbers. So we usually, as you know, can determine a woman's due date of her pregnancy and listen to a heartbeat around that 6.5 to 7 week mark. But I tell patients, if they have a positive pregnancy test, there's no wait. They can come in for a free consultation and meet me, because it's a big decision to determine where you want to get prenatal care from. Learn about our practice, meet me in person. They're obviously welcome to bring their partner. And a lot of times I'll do those visits, and then that way we can really go through thoroughly through a patient's medical history, pregnancy history, even if it is 2 or 3 weeks too early to, say, listen to a heartbeat or confirm a due date. And then usually those patients would come back around 7 to 8 weeks. And that's the really, you know, big visit where this visit usually lasts over an hour at my office. So when I worked for busy clinics, these were often 15 or 20-minute appointments. We call them the new OB visit, or first prenatal visit, at my practice is usually 60 to 90 minutes. It involves a thorough review of one's history, an ultrasound, every aspect of a physical exam that's indicated. And that's just the beginning, right? Then we go over and explain all of the different options for genetic testing, carrier screening, NIPT, questions about amniocentesis that come up, and then setting a stage for what the plan is moving forward. Another thing that I don't think obstetricians do enough of in this country is I like to ask every one of my patients, what are your goals for pregnancy? We can all say we want mom to be healthy and we want the baby to be healthy. That's a given. But every woman has different goals. Some women, for example, might say, Dr. Thompson, I want to do everything possible to not have a C-section. And I say, excellent. I want to tell you all the things we can do together to help decrease the risk of you needing a C-section. We talk about diet. We talk about exercise routine throughout the whole pregnancy. I talk about different things I can provide leading up to and through the birth process to lower their risk of a C-section. But on the flip side, I have patients that are completely opposite. They say, Dr. Thompson, I'm still thinking about my options, but I want to know right now, do you support my wish if I want an elective C-section? And I say, absolutely. I think we should talk more about the pros and cons of each. But yes, I 100% support your decision for how you want to have your baby. And so it's a very long visit, but it's a very fun visit, in my opinion, most of the time, because we're able to really connect. And I see patients leaving my practice with just a much lower stress and anxiety level, because they know there's a lot to get through and that it's going to be a long journey. But I hope that they really feel like they have a partner right from the get-go.
Yeah, that is fabulous. I love that question. What are your goals? I think when you go to a large practice in a big system, yeah, no one's got time for that, right? Like it's just sort of here are the metrics that someone has set for us, and we're just trying to reach those, and everyone's the same, and we just have 10 minutes to get through this appointment. Like, in your mind, you're like, please don't ask me any questions, right? Like, I mean, it's kind of terrible, right? But we know that patients have a lot of questions, especially when it comes to OB, and especially when there's a complication or there's an issue that arises. Those visits can really take longer. So it's so nice that that first visit is 60 to 90 minutes. I mean, I know it's only about 20 minutes in most other offices, which just seems so less.
Yeah, and I know that on the gynecology side, you're passionate about the same thing. And,
yes.
And same thing with when a woman has a problem with, say, abnormal bleeding or fibroids, endometriosis, maybe even considering a big upcoming surgery. It's amazing to think that in the standard healthcare system, we expect women to have to, over 10 or 15 minutes be able to process all this information. And I think that that's one of the great things about what you're offering is not only can you get patients in quickly, but you have the ability to give them the time so they can really figure out what the right decision is for them.
Yes, no, definitely. So that's why we're big fans of this model. And your practice is called Dedicated Pregnancy Care. Is that right?
That's correct.
Okay. And so, and you are the only doctor in your practice at the moment. So you're seeing the patients throughout the entire 9 months, and then also delivering them, right? And then also seeing them afterwards.
That's right.
Okay.
That's right. Yeah, that's again another, postpartum care in this country is just despicable. A lot of women are offered one quick 15-minute visit at 6 weeks postpartum. So first of all, my patients know they come in any time for any question or concern. We offer 2, 4, and 6 week postpartum visits for every single patient. It doesn't matter if you had a vaginal delivery or C-section. It doesn't matter if you had complications or no complications. Some of our patients take us up on that and come in at 2, 4, and 6 weeks. Some patients maybe just come, give a quick call we set up like a telehealth visit at 4 weeks if it's more convenient for them. But the important thing is that women, after we, get to meet their baby, they don't just feel like, okay, you're kicked to the curb now. And sure, come in at 6 weeks postpartum, but part of that, we don't really want to hear from you. It just really is sad to me.
Yeah. Well, that's so great. Okay. So tell us more about how to find you, and what's your wait time like? Is there a wait time right now if a patient is like, oh, you know what, I have positive pregnancy test this week? How quickly can they see you? Because I know that's a big issue.
Totally.
So many patients can't get an appointment for 6-8 weeks. And so, which is bad because they're missing important tests. Right. So tell us about that.
Yeah. So we have a website. It's dedicatedpregnancycare.com. That has our phone number that patients can call to make an appointment. There's also a way that the patients can enter their phone and email address and send us a message, and we generally get back to patients within 1 day. In terms of appointment availability, we have next day and same day appointment availability. And so what that looks like is if a patient gets a positive pregnancy test, they can call us and we could, for example, we could see them tomorrow, see them Wednesday of this week. Sometimes patients aren't in a rush necessarily, and they want to just schedule for the next week. So that's fine too. But yeah, we maintain that. One of the ways we do that is we cap our practice at the number of due dates per month. So I have a calendar, and every patient I have, their due date is on that calendar. And our goal is to never have more than 6 due dates per month, which for some people sounds like a lot, but I'll tell you, as an OB that was delivering, 30 babies per month for a busy practice, 5 or 6 patients per month is a very manageable number.
Yes.
And so that really allows us to have capacity for office visits. But it also means that when I'm, going in and delivering a baby at 2 a.m., my patients are often, they're funny. They all often apologize. They say, "Oh, Dr. Thompson, we're sorry that our baby decided to come at 2 a.m." I say, "That's okay. I'm excited to meet your baby, and I'm well rested." Because sure, maybe I had another delivery a week ago or 5 days ago, but between, I'm able to get some rest. And that's kind of the beauty of, again, this practice model that you and I are both pursuing is, I think, really having the bandwidth for our patients, not constantly being on the verge of burnout.
Yes.
And so I compared to how I felt when I was an employed physician, I feel like I am truly present. I am rested. I am ready. And so I think ultimately, I think that's good for us as people, as human beings who have families and have a life, but I think it's also really good for our patients.
I couldn't agree more. I mean, yes, that's a huge difference. The pace at which we move now just allows more comprehensive care, and we are present. And as I said in a recent blog post, it allows me to be there for myself, which allows me to be there for my patients, which should not be underestimated, because a lot of physicians out there are just, totally burnt out and or on the brink of it, right? So
I think what you and I are doing, we have there's a lot of phenomenal physicians in this country, right? I mean, I'm not one of those people that think that, well, I'm doing this because I'm just better than everybody else. I love what I do. I know that you love what you do, and we constantly are trying to get better at what we do. So I think that is important. But really what we're doing is we're being brave and creating our own system.
Yes.
Because for so many patients, it's the system that dictates their experience.
Exactly. Now, do you also do some televisit? Because I'm thinking about patients on this side of the Bay. I know you're in Palo Alto, but a lot of the, for the first several months, it's just one visit a month, really, to come in. But if something were to come up in the middle, can patients, say in the La Morinda area, do a televisit with you?
Absolutely, yeah. So a lot of patients, even before pregnancy, I do preconception visits.
Okay.
And so a lot of patients, even before they get pregnant, that way they have the chance to meet me. I do those in person or via telehealth. Obviously, for things like ultrasound and exam, they would need to come in for that. But I do telehealth for that. And then I always kind of reassure patients that any patient that we've seen for a preconception visit who's an existing patient, always gets priority in terms of scheduling as a new OB patient. And then, yes, all of my patients get my personal cell phone number. So the answer to the question is yes. If there's a quick question and they want to set up a telehealth visit rather than making the drive all the way over, we do that. We send them a Zoom link, and we have a HIPAA compliant telehealth visit. On the flip side, if patients want to just pick up the phone, my patients will send me a message, say, "Hey, how is 1 p.m. today? Can we get on for a quick call?" I said, "Absolutely, sounds great." And so it's really nice, just have that conversation. Last week, a patient called me as she was walking out of her anatomy ultrasound. Everything was great, but she had a couple little questions about the report, some of the big words that were used. And she just said, "Hey, can I just call you?" I had a nice opening in my schedule. I said, "Sure, let's just chat." And it was nice because at 2 p.m. on a Friday, we were able to talk about her ultrasound and go over everything, answer her questions, and I could kind of feel the stress and anxiety level coming down. And she said, "Great, I feel so much better now that we could just have this quick conversation." It just makes you feel really good that you can offer that.
Yes. Pregnancy is stressful as it is. So anything that can lower that stress level is awesome.
Pregnancy is stressful enough. We don't need to make it more stressful, which unfortunately I think sometimes the healthcare system definitely does.
It's I love what you're doing. I have 3 kids myself, and especially my last one had some issues. I would have loved this kind of care. So I'm so proud of what you're doing, and I want to encourage anyone who's watching to really check out Dr. Thompson's website, dedicatedpregnancycare.com, to learn more and do a meet and greet with him if this is a model that interests you, because I think it's so unique. I don't really know anybody else who is doing this. So it's such a unique model and a great service to patients and great value for yourself, your baby, and just your whole pregnancy journey. I know there are so many patients now who are undergoing expensive IVF treatments, and when they're finally pregnant after years, they just want, they're just like, they just want everything to go right, and they're looking for care that's very personalized. And so this is I think a perfect practice for that. And so yeah, please check out Dr. Thompson's website. And do you have any last words to add, Justin?
Well, I just want to say thank you so much. That really means a lot, especially coming from you, Cheruba. I really look up to you as a friend and colleague and really mentor at this point. I know we both started our practices in the recent past, but again, happy birthday. Your practice has now been here for a year. And I really see it as every time a physician like you and I takes this path, it gets a little bit better for patients. And I guess I just want to close with the experience that, a patient I referred to you last week who's on her fertility journey. She needs to consider a gynecologic surgery prior to proceeding with her embryo transfer, and was told by a busy OB/GYN clinic here that the first available appointment, not surgery, but just appointment, was going to be 5 weeks. And she reached out to me and said, we really want to come to you for pregnancy, but we're not quite there yet. And now we have to have this big time delay. And I said, you need to go to La Miranda OB/GYN. You need to pick up the phone right now, because this is a patient that as part of her fertility journey, she can't even come to me because of this big delay in the kind of traditional healthcare system. And so I'm just so excited to build the relationship that you and I have, and hopefully we'll meet more physicians doing what we're doing, because again, every time there's a new one of us, I think it gets a little bit better for patients.
Yes, 100%. Very well said. Well, thank you so much for joining me on this lunch hour. Thank you to those who watched, those who are watching the replay. Feel free to type in any questions that come up into this chat, and we will get back to you. And have a great afternoon, everybody. Thanks, Justin. Okay,
Yeah, thanks, Cheruba.
bye.
Take care. Bye-bye.
Bye.